Hello, this is Dr. Joe Gary from Mosa Plastic Surgery. Welcome to episode number 9 of the Surgeon's Corner podcast, a series dedicated to patient education on topics related to aesthetic plastic surgery. Our topic of discussion for this episode is the brow lift procedure. The eyebrows frame the eyes. Their position at rest and with animation can convey a multitude of emotions such as sadness, surprise, etc. There's a general understanding of what the proper eyebrow position and shape should be in the young and aesthetically pleasing face. It is generally accepted that in men, the eyebrow should have a more horizontal shape and be at the level of the upper border of the orbit, which is the bony cavity in which the eye sits. In women, the eyebrow should have a more arched configuration, and its highest point should be about 1 centimeter above the orbital rim. In both men and women, the medial aspect of the eyebrow, which is the part that sits closer to the nose, should always be lower than the lateral eyebrow. The more arched female eyebrow should have its peak approximately at the level of the lateral limbus, or the junction where the white sclera of the eye meets the cornea on the lateral or outer aspect of the face. From this high point, the eyebrow should descend slightly as it travels laterally. Just like it affects the rest of the face, the aging process also affects the periorbital region, which encompasses not only the eyebrows, but also the upper and lower eyelids. Although there is significant interpersonal variability, most of these aging changes are fairly typical for most patients and include ptosis or droopiness of the eyebrows, excess skin of both the upper and lower eyelids, as well as fat bulging or pseudoherniation of both eyelids, giving the entire periorbital region a sad, tired appearance. Rejuvenation of the periorbital region usually involves addressing the eyelids and eyebrows together, but for the sake of this discussion, we will focus on the eyebrows only. The main goal of eyebrow rejuvenation is to take a ptotic eyebrow which has descended in time and in essence lift it into its proper position and give it its ideal shape as described above. Although there are several described techniques to achieve this goal, most of them fall into two main categories: endoscopic or open. The main thrust of these procedures, no matter the technique used, is to gain surgical access to the tissue underneath or deep to the eyebrow in order to release the ligamentous attachments that tether the eyebrow. Once these ligamentous attachments are released, the eyebrow is shaped and lifted to its ideal position. The access points are small incisions that are made in the upper forehead just in front of the hairline or in the hair-bearing scalp immediately above the hairline. Once the eyebrow is released from its underlying attachments, it can then be repositioned higher or lifted into its proper position by placing traction on the skin and deeper tissues of the forehead. This maneuver can result in excess skin along the incision, which can be removed as needed. It is imperative to then anchor the eyebrow to its new position. This can be done with sutures anchored to the underlying bone or to deeper tissue planes. Another option is a resorbable anchor plate, which can be used to secure the newly repositioned forehead tissues to the outer bony layer of the skull until healing occurs. The complications profile for this operation is acceptable in lieu of the benefits that are possible. Forehead hematomas and mild brow asymmetries have been described. The incisions are small and well hidden, usually leading to imperceptible scars when healed. The brow lift is a well-tolerated procedure which can be done either alone or as part of a comprehensive facial rejuvenation plan, which might include a facelift or eyelid surgery, for example. The brow lift is a subtle but yet powerful procedure which can frame overall periorbital rejuvenation and give the eyes a more open, engaging, and youthful appearance. Thank you very much for your time and attention. This is Dr. Joe Gary. I'll see you in the next episode of the Surgeon's Corner podcast.